Hello and welcome to World Insight with me, Tian Wei. The program is coming to you live from Beijing on CGTN. The Forum on China-Africa Cooperation Summit will be held in Beijing early next month. Ahead of the summit, representatives from China, Africa, and various international organizations have attended a meeting on health cooperation in Beijing last weekend. Health cooperation has been a major theme of cooperation between China and Africa, covering areas of disease treatment and ways to improve the pharmaceutical industry. Before we get down to the discussion with three health ministers coming from the African continent, let's take a look at this first.
A busy yet constructive agenda awaits President Xi Jinping and African leaders on September 3 and 4 in Beijing. On Wednesday, State Councillor and Foreign Minister Wang Yi announced details of the 2018 Forum on China-Africa Cooperation. Health cooperation was the focus of a two-day high-level meeting in Beijing last weekend, which also provided an important platform for collective dialogue ahead of the forum this September.
Through technical cooperation and various projects, China and Africa continue to blaze new trails in health cooperation. Some of these projects include the construction of disease control and prevention centres, human resources development, and implementing local production of medicine.
As one of the 10 major plans from the 2015 Johannesburg Summit, China-Africa health cooperation has grown with support from the World Health Organization under the United Nations. In recent years, China has steadily helped Africa improve its public health systems and pharmaceutical industry. This kind of help has been critical in curbing the spread of some deadly diseases. China has sent medical teams with donations of equipment and medicine to Africa. Shared expertise has led to local resources being used for producing drugs, expanding the market, and developing pharmaceutical research and technology. But huge challenges remain. In Africa, poverty and infectious diseases such as Ebola are weighing down the health system. Complicated political and security situations also hamper health efforts in some regions. There is still a long way to go in providing universal health care on the continent of Africa.
Sitting here, we have the Minister of Health coming from Nigeria, Minister Isaac Adewole.
Thank you.
Good to see you, sir.
It's a pleasure.
Joining us in the middle of the team, we have the Minister coming from Tanzania, Madam Minister Umi Mwalimu.
Yes.
Good to see you, ma'am.
Thank you very much.
What a pleasure. Last but certainly not least, coming from Zambia, Minister of Health, Chitalu Chilufya. Good to see you, sir.
Thank you so much indeed.
Why is it important building pharmaceutical industry in your country?
Pharmaceutical sector is so critical to health system strengthening. If we have to ensure that we have universal health coverage, we have to fix one fundamental pillar of health systems, that's the supply chain. So the pharmaceutical sector is such an important component of the health systems. So why it is important to produce locally, you need to shorten the lead time. And it's important as you shorten the lead time to ensure that other ripple effects accumulate to the country, such as employment creation, prevention of capital flight, so that you don't damage the economy, and also importantly, capacity building in country, so that you build capacity locally in production.
Right.
So as you partner with the private sector, yes, they're producing, but you also have an opportunity to train production pharmacists. Critically, it is important to note that Africa imports over 90% of its pharmaceuticals.
Yes.
Now that in itself not only predisposes Africa to fake products, but it also predisposes Africa to drug stockouts.
The little resources we have, we are basically changing into foreign currency in order to get medicine.
Right.
We are relying on foreign regulatory bodies. We want to rely on whether to ensure quality and safety of the medicine.
Of course, these are important, but very hard to meet.
African government, including Tanzania, we have already created the enabling environment to support the local production of pharmaceuticals industry. For example, in Tanzania, we have already adopted tax incentive to make sure we encourage investors to come and invest in Tanzania. We have already prepared the market within Tanzania, within East Africa and Southern African region.
What are the measures you are specifically talking about? Can you give us one or two examples?
Number one, for example, we have cut taxes for local production of pharmaceuticals.
How much?
For corporate tax, from 30% to 20%. We have already also adopted zero VAT tax for locally produced packaging materials for pharmaceutical industries.
I see.
All we are doing this, we want to make sure we encourage local production of pharmaceuticals in order to address the challenges.
Mr. Minister, I wonder whether it's the same thing with your country as well.
Well, they are quite similar in Nigeria. Our president has issued what we call executive orders, one of which is designed to ease the challenges of doing business in Nigeria. For example, you will get visa on arrival. We will provide land. We will also allow you to repatriate your profit. In addition to that, we will also ensure that we keep strictly to some of the new incentives that are bound in the country. When you import raw materials for pharmaceuticals, the tariff is 0%. When you bring in finished products, you pay between 15 and 20% tax on the product.
As we all know, pharmaceutical industries, one of the most important things is about quality.
Correct.
Drugs, if it is not serving the purpose, actually is killing people.
Yes,
So consequence is much bigger than any other product. Even China and India, which have been termed as so-called the emerging economies, they have problems with quality control, as being demonstrated recently with some case studies. So how to make sure, when working with these countries, whether developing or emerging or developed countries, that you are getting the real product, the real quality, first of all. And secondly, particularly when localizing it, the quality control, how to make sure that will be the most important component of everything.
For example, in Tanzania, we have a national regulatory body, Tanzania Food and Drug Authority, which is ISO accredited.
Yes.
So it is well recognized within Southern Africa.
But, you know, Madam Minister, I have to argue that many of those administrations for quality control about drugs around the country, around the world, are actually ISO qualified.
Yes.
But still, there are problems.
I do want to acknowledge their problem, but they are very, very efficient, very professional. We follow even the European standard. Whatever has been actually approved by Tanzania Regulatory Authority body, it is also going to be acknowledged by European Union standard. So for that particular issue related to quality, it is not a big deal. That's why for us, we think local production of medical products in Tanzania, it is also one of the initiatives to guarantee Tanzanians that whatever they get from the company has standard of quality and safety to their life.
I see. It is crucial, the quality.
Crucial, yeah.
Mr. Minister.
The situation is similar in Nigeria. We're quite
We're
concerned.
always into solidarity, it seems.
Well, because we have a common platform, the African Union, and that has also given us the opportunity to network and also work together. So we're quite interested in the quality of the product and ensuring that, one, we look at the quantity and also ensure that we have the right medication within the medicine. Because it is possible that you have fake product. It is also possible you have substandard. You also have inadequate quantity. And so we're partnering with the universities. We're setting up quality control laboratories for the Nigerian Agency for Food, Drug Administration and Control, NAFDAC. And we're also planning to set up a bioequivalence laboratory very soon, and to make sure that we are able to measure that the so-called drug that has 500 milligrams of a medication truly has 500 milligrams, not 300, not 250.
That's right.
So I think we are quite concerned about this.
fake products, for example, particularly fake drugs, has a lot to do with the corrective process in which it was certified, produced, and examined and checked. So every special point along this long process of producing drugs and medicine are all important.
Correct.
That is the sophistication part of it, and that is the most difficult part of it.
I think we will address this quality by looking at it from end to end.
Go ahead.
Right from the country of production down to the time it is shipped until it gets to our country. So we can gather. But many of these can be bypassed when those drugs are produced locally. You bypass critical components of the supply chain system if you produce local. And that's one of the greatest benefits of local production. Because you are actually cutting into almost 50% the chain. And so it's much easier. And in partnership, because some of these companies are operating in partnership, they will also want to keep their brand, they will also want to retain their reputation, and to me that is critical to many of them.
This is exciting what you're doing right there in your country, but certainly it's very challenging because you have to start everything from scratch, almost.
No, we are not really starting everything from scratch, because we have actually laid down the foundation.
Yeah, but now your different areas of working have been increasing, and you have to make sure they're balanced.
Of course. Now we are talking even emerging and re-emerging diseases, for example, Ebola and dengue fever, whatever. So what is important for us as the government of Tanzania, it is our passion, our vision to become a middle-income country through industrialization. So one area which we have identified is local production of pharmaceuticals. We know it will not only enhance accessibility and affordability of pharmaceutical products, but also it will create employment, it will also bring the taxes to the government.
Drug quality is one of the biggest health concerns in Africa. Political stability and security also have an impact on the continent's universal health care system. With these challenges, how are Africa's health authorities coping? What about efforts to encourage local drug production? African health ministers told me their thoughts in the interview. Is the politics stable? What we are talking about today are still likely to be the plan for tomorrow?
One of the beauty of Africa is the fact that Africa is becoming more and more stable. Military intervention is becoming an abnormality. Since the intervention in Gambia, our leaders dispatched troops to Gambia and brought out and restored civil rule in Gambia. And so, for many of our countries, stability is becoming the order of the day. And that's one of the things we are selling.
Okay. Mr. Minister from Zambia.
I must state that Zambia has been a peaceful haven and therefore the right destination for investment. But as my colleagues have said, generally Africa has become more stable, and Africa is a place to invest because the population is there, the market is there, you know, so the demand is there, and now the environment is being enabled. The politics, today Africa is boasting of political will to improve health systems, because Africa is unanimous that sustainable development is linked to the health of its people.
But come on, I mean, you all know, Mr. Minister and Madam Minister, the world is changing. Very dramatically, I should say. At this point, geopolitics unpredictable, as we all know, and therefore that's likely to have a big impact on Africa as well, like it or not. What about these vulnerabilities, Mr. Minister?
Well, every country is vulnerable. But when you look at it, I think things are taking a turn for the better. We're vulnerable to floods, to disasters, and so on. But when you look at it, Africa is free from earthquakes, free from tornado. All the serious things that afflict other countries, we are free from it. The only affliction we have has been military coups and instability, which is becoming a thing of the past.
Where does the money come from? That's another important issue, isn't it?
A resilient health system is anchored by a robust healthcare financing program. Africa needs to do more to increase domestic financing, become less reliant on donor funding, but we must increase our allocation towards our health programs in the country. Where does the money come from? We must innovate. We must ensure we set up innovative financing mechanisms. In Zambia, we've passed a law called the National Health Insurance Act, number 2 of 2018, which has introduced compulsory health insurance. Now, that pooled funding, that solidarity, inclusivity, it reduces the premiums and also creates or is a significant step towards universal health coverage. But we must also look at sin taxes, the sin of smoking and drinking. We must ensure that industry becomes more responsible. We must ensure that while we discourage smoking, if not ban smoking, we must ensure that the industries, actually the taxes we pay, we get from there going to healthcare, including alcohol.
That, of course, is the innovative way of doing things. But at the same time, Madam Minister, the IMF funding, for example, many of the African countries are working with, are not necessarily going to be a guarantee for your investment mechanism. It's going to be only a proportion of it. Meanwhile, the international aid coming from developed economies, as we have seen over the past decade, have been decreasing. Thirdly, China and some of the other emerging economies are willing to work with Africa. But certainly, they all have their own issue to struggle with as well when it comes to economy and trade. So, Madam Minister, where does the money come from?
It does actually. First of all, we do recognize we cannot rely on foreign support. So we have increased domestic allocation to address healthcare challenges in Tanzania. For example, last financial year, it was 9.5% of the national spending. Right now, it has gone up to 10.80%. But like in
Thanks
Zambia,
to your hard work.
Yes, but because at the end of the day, it is very easier to convince the minister responsible for finance to give you more money if you deliver. So they just want to see results. Like in Zambia, we are going to introduce a mandatory health insurance. So Tanzania's population is about 55 million. So maybe if we get 70% of households covered by health insurance, they will be basically contributing.
But what would be the minimum amount they have to pay for that? We all know there's a different, families with different income levels.
We are thinking maybe the minimum amount could be $10 US.
I see.
Yeah, in tissue.
For a year?
For a year, for a household of 6 people. But we are also considering we have already developed our health financing strategy, like in Zambia with the support of the World Bank. So we want also to maybe get some money from sin taxes, for example, or from sugar importation, because we want also to address non-communicable disease. So while we acknowledge and appreciate the support of our partners, we also want to do our job. We have to increase domestic allocation.
Of course, there's one important issue that we haven't touched on. That is, with all of these wonderful ideas and some of the important things for you to figure out, for example, about funding and others, what is the best mechanism to work on this? You touched a bit about your domestic system in each country. But on the other hand, you have many options. For example, you can work with international organizations. You can work with the NGOs. You can also work with different kinds of governments, China included, with the Belt and Road and many other initiatives. But how to weave them in the best and the most efficient way to provide the best answer to your country?
We cannot do away with international partners. But what we are also doing in Nigeria, which is different, is to network with the private sector. There is a lot of resources.
To bring the vitality within.
Oh, yes. The private sector has a lot of resources. They have efficiency. They have discipline. And we thought that creating the convenience, a marriage of convenience between the public and the private sector will help to drive our agenda forward within the context of, and then we're setting a priority as a nation. And we're telling our partners, this is our priority. Come and join us with us to move the health sector forward. And I think this is what will be sustainable.
All right, Madam Minister.
Yeah, for us it is almost the same like Zambia and Nigeria. We have already defined our priorities. While we continue working with partners, including international organizations, but we have always actually insisted the importance of coordination among partners, because sometimes you may find 1 or 2 partners addressing 1 or 2 same activities. So we want coordination of partners in order to make sure we have got a bigger impact. But number two, private sector engagement is very, very important right now, and civil society organization. I just want to give an example of tuberculosis in Tanzania. Before, I didn't give the private sector any money, but I called them. I want you to work with me in order to detect TB cases. They said, Madam Minister, we are going to work with you. When they decided to do that, they increased case detection for the tuberculosis from 5.4% to 10%. I didn't give them a single dollar.
But only a policy.
A policy,
and
because I encourage
to
you
work
that
with
you
them.
are right.
Exactly.
Yes, they just need to be recognized and appreciated. But another important, we shouldn't ignore the role of the community. It's very, very important. Some intervention can be even implemented within the community without even spending any financial resource. Just the involvement and engagement of the community.
Before we go, one crucial question to ask the three of you. You are here not long before the China-Africa Summit for Development. What from the Minister of Health is expecting that the national leaders, when they conclude that summit, will come up with when it comes to the area of your expertise?
FOCAC should be an opportunity to drive a people-centered, sustainable development program.
My expectation, a focus on promoting local investment on local production of pharmaceuticals.
I see. And Mr. Minister, last but not least.
For us in Nigeria, China is noted for investment in infrastructure, railways, airports, roads. We want to see a recalibration of China's investment in Africa away from hard infrastructure to soft infrastructure, and more investment in the people of Africa with a strong focus on health of our people.
So it could be a win-win for everybody.
It will be a win-win.
All right. With that confidence, we have to wrap up today's discussion. This is an absolutely fascinating topic, and congratulations. You have a country and a continent on its way up. Thank you so much for being with us.
Thank you so much.
Mr. Minister
Thank you.
and Madam Minister.